We are now on the Child Care and Development Block Grant of 2013. I know that Senator Alexander and I and others were anxious to consider amendments. I encourage people who have amendments to bring them to the floor so that Senator Burr, Senator Alexander, or I, or Senator Mikulski could look at them and get things lined up. It is my intent, and I hope I can speak for Senator Alexander in this too, to have an open yet managed process with respect to this bill for senators to have relevant amendments, to have the opportunity to have them offered and to be voted on. I expect that we would have a couple of votes within the next few hours. I don't even know, but sometime soon. So again, I strongly encourage senators with amendments to bring them over and file them so that we can get them discussed expeditiously. Madam President, this bill was voted unanimously out of the Help Committee last September. I hope it will receive strong bipartisan support here on the Senate floor. And again, I want to give tremendous credit and thanks to Senators Mikulski and Burr, the sponsors of this legislation, for their leadership in this process for over a couple of years, working together, creating a bill that takes huge steps in improving the lives of children and their families. And at the outset, I also want to thank our ranking member, Senator Alexander, for his partnership and for working with us to reauthorize this vital program. Our offices have worked very collaboratively over the last couple of years to produce a strong bipartisan bill. If I might, I just start first by saying that this program has a big impact in my state of Iowa, too. Right now, Iowa serves about 15,800 children every month with CCDBG funds. And as you can see, about 28% is infants and toddlers, about 26% ages 3 and 4, and about half, 46%, ages 5 to 13. And again, I want to continue to make it clear that most people think of this simply as a child care type bill that's for infants and toddlers. That's not so. This goes to age 13. But about half of it, about half, goes to those under the age of 5. The last time this was reauthorized in 1996, 18 years ago, this program was basically looked at as mainly a work support program, a work-related support program, taking care of kids while parents went to work. It was only incidentally thought of as something that could have a real impact on the kids. Well, 18 years later, backed by impressive scientific research, we know the program can and should be much more. In addition to providing vital work support for parents, it can be a rich early learning opportunity for children. In 2000, the National Research Council published a groundbreaking report called Neurons to Neighborhoods. The report's authors said that from the time of conception to the first day of kindergarten, development proceeds at a pace exceeding that of any subsequent stage of life. That what happens during the first months and years of life matters a lot. Not because this period of development provides an indelible blueprint for adult well-being, but because it sets either a sturdy or fragile stage for what follows. And what this bill does is set that sturdy stage. This report that I talked about from the National Research Council reinforces what we kind of already know, that learning starts at birth and the preparation for learning begins even before birth. 80% of a child's brain develops between birth and age 3. Because much of a child's intellect and skills develop before he or she begins kindergarten, we need to give all children every opportunity to reach their full potential at the earliest stages of life. This means supporting access to high-quality early learning programs, including high-quality child care. And the bill here before us represents a strong and positive advance for low-income families who benefit from the child care subsidy. Now, the bill makes many needed improvements that will help establish high expectations for federally subsidized child care in this country. The bill accomplishes a lot of things. I'll just highlight a couple of 3 things here. First of all, education and training for child care workers. Under this bill, the states that apply and get these block grants will need to develop minimum education and training requirements for child care workers. that describe what they must know and be able to do to promote the healthy development of the children they serve. Just as we know that a great teacher is one of the most important factors in the classroom, we also know that one of the most critical components of early development in children is whether they have a supportive, nurturing interactions with caring adults. Again, another important thing we do in the bill is to promote safety and health standards. This bill ensures that licensed child care providers receive a pre-licensure inspection and at least one annual inspection thereafter. Alarmingly, some states inspect child care centers only once every 5 years. Some states don't even do a pre-licensure inspection until a provider is serving more than a dozen children. The bill also stipulates and focuses on vulnerable populations, including basically children with disabilities, infants and toddlers, children whose parents work non-traditional hours. I want to highlight that the sponsors of this bill, Senators Burr and Senator Mikulski, took great care to ensure that child care programs supported through this block grant will be well suited for children with special needs and their families. The legislation asks states to consider the unique needs of children with disabilities when developing training requirements for child care workers. A child care worker may be trained to take care of non-disabled children, but taking care of kids with disability requires a little bit extra expertise, a little bit extra training, and that's what this bill does provide. It also lets parents know, gives them the information to parents to know the types of services available through the Individuals with Disabilities Education Act. The bill also provides families with stability on continuity of care for families. That once they receive care, they're going to get it for at least 1 year once they're initially deemed eligible. Currently, some states require parents to reapply for care after only a few months. In some cases, states will kick parents off of care if they receive a small pay raise that makes them ineligible under the state's eligibility guidelines. This bill remedies this by ensuring that as long as a parent is working or in a training program and whose income does not exceed 85% of the state's median income, they'll get a care for at least 1 year without having to worry. Again, this helps children because we know that a lot of times these kinds of disruptions can really set a child back, and this allows at least for that continuity for one year. The bill also supports the development of a website. Again, I know Senator Burr was very interested in that and helped promote that and put that in there, development of a website that's going to be available to all parents to show them the range of child care providers in the area so they can shop around, see what's out there. Now, I have the other one that's on front on the current access right now. Right now, the law says states can set their eligibility requirement as long as it doesn't exceed 85% of the state's median income. But if you look at all of the children aged 0 to 13, that's because the bill covers up to age 13. If you look at preschool age kids, those 0 to 5, we do a little bit better. And states are serving a little more than a quarter of children who would be eligible under the federal guideline. I think this shows the present landscape right now. Out of 100% of the kids that are eligible, we have 73% eligible but not being served, about 27% served of children. So we do have a long way to go. As chairman of the Appropriations Subcommittee on Labor, Health, Human Services, and Education, our committee has fought for years to increase funding so that we can serve more children. The fiscal year 2014 omnibus included more than $154 million increase for the child care program. Well, I know that sounds like a lot, but all that did basically was replace the $118 million cut that happened because of sequestration. So we replaced the $118 million plus whatever that figures out to about another 36 more million dollars. So it helps. The increased funding will help states improve access to quality and affordable child care by increasing the number of kids who can receive it. But actually, we have a long way to go, and the last chart kind of shows what's happening here. If you look at the blue line at the bottom, that's the actual funding under this program. If we go back to 2005 and we see inflation, we're about $600 million short of where we'd be if we just kept up with inflation. So you can see just since 2005, those who have been around since then, we know what it was like before that. We have lost a lot of ground. So we need to make that up, and I hope that we can do that in our appropriations bills that are coming up. So again, this bill changes the landscapes, makes things a lot better for families out there, but I just wanted to mention the funding. This bill authorizes it, but the appropriations has to fund it, and I hope that we can, in fiscal year 15, continue to be able to keep up the funding increases for the Child Care and Development Block Grant. So, Madam President, it's a good bill. I'm very proud of this bill, proud of the efforts that Senator Burr and Senator Mikulski have put into this over a long period of time. So I urge my colleagues to join in the bipartisan spirit of cooperation that we have witnessed in the Help Committee over the last year. And as I said, if senators have amendments germane to the bill, I encourage them to bring them over so we can take a look at them and determine a fair path forward with respect to those amendments. So, Madam President, I yield the floor, and again, I want to thank Senator Alexander for a great working relationship on this committee, and thank him for working so hard to help bring this bill forward to the floor today. I yield the floor.